The immediate past president of PSN, Alhaji Ahmed Yakasai, has given the outgoing executives led by him a pass mark. Yakasai submitted that his team have lived up to the promises upon which they took office. He made this known at the 91st Conference of the Pharmaceutical Society of Nigeria, PSN, tagged Innovative Disruption in Pharmacy in Emerging Economies, a roadmap for Nigeria in Ibadan.
Exactly on Friday, 13th of November 2015, at the 88th PSN Annual National Conference, Unity 2015, Abuja, you gave me the mandate to move our profession to the next level of advancement, especially for the Pharmaceutical Society of Nigeria. The oldest and most organized professional body. This I will remember forever. And truly it is this trust that gave me the courage and strength to dedicate my life to the service of our noble society and beloved country. My mission was to strengthen the Pharmaceutical Society of Nigeria with collaborative, participating, and responsive and transparent leadership.
He expressed happiness that PSN championed the cause of improving the healthcare delivery system in Nigeria. He added that his leadership made updating and improving the element of PSN, running an accountable and transparent organization, creating an efficient and responsive forum a priority.
I don't want to sound immodest or unnecessarily blow our trumpets, but I must say that we have kept our promises. I have kept the promises. I have kept the promises. We have served you and our noble profession with all our body, mind, and soul. I know what I've gone through. I have sacrificed my time, businesses, and comfort to make sure the confidence reposed in me to lead our society is honored.
He also highlighted some of the things achieved by the PSN during his tenure, like the reclaiming of the PSN Victoria Island property, launching of Medicine Information Centre licensed by the UK Medicine Information Centre to provide pharmaceutical information to healthcare providers, inauguration of the PSN Narcotics and Drug Abuse Committee, among others. According to him, I made deliberate strategic efforts to build partnership among our technical groups towards professional and national development to demonstrate that pharmacists can make the country proud by looking inwards to produce medicine for our people. Meanwhile, the President of Healthcare Federation of Nigeria and MD, JNC International Limited, Claire Omaseye, has emphasized on the need for innovative disruption for a more robust and efficient healthcare delivery system. Delivering the keynote address at the 91st PSN conference, Omaseye said,
Our pharmacist-to-patient ratio is extremely low. The number of nurses that we have is way below par. So it means that we need to look at how maybe we can leverage on technology to close that gap and start to think out of the box on some new ways of thinking. We need to look at the supply chain. How do we get essential commodities and essential drugs faster to our patients? So technology is moving ahead. Are we as pharmacists moving with technology, moving with the patient? Because our patient is. Then when we talk about innovation, we're thinking of doing things that enhance the way we do our business today. So technology is one of those ways in which you can enhance your business.
Banking, telecommunications industries and others have since embraced technology to improve operations. When we talk about commerce, we have so many online stores today where you can order items online and get it delivered. The pharmaceutical industry cannot afford to be left behind. It needs to be able to deliver quality assured, affordable, accessible, essential medicines. Omaseye challenged key players in the health sector, especially pharmacists, to be disruptive in their thoughts by using the leverage of technology to become effective in procurement and supply chain management. She opined that innovative financing of healthcare by placing taxes on luxury items should be looked into by the appropriate authorities, as access to finance has been a major challenge.
One is what you call domestic resource mobilization, where we can all decide that we should put a tax on things that are sometimes called sin, but for me I will not call them sin taxes, I will be diplomatic and call them luxury taxes. And alcohol is not compulsory, gentlemen and ladies in the room. Cigarettes are not compulsory, and neither are sugary drinks. So these are luxury items. So should you want to consume them, smoke them, drink them, we will put a 1% tax that we put together and it goes into a healthcare fund.
Another thing we can look into is for every community pharmacist to have an interactive website that is mobile responsive, where drugs can be bought online. Omaseye also highlighted the need for strategic collaborations to address the crisis in the health sector. According to her, as pharmacists, we have a crisis because 70 to 80% of our drugs are imported. The contribution of pharmacy to the whole GDP of the country is 0.74%. The contribution of pharmaceutical manufacturers to total manufacturers in Nigeria is only 2.38%, which is very appalling. Why this is so is because we import almost everything: the raw materials, the packaged materials. We also have high taxes on importation. There are a lot of inefficiencies in the system. Therefore, what we are doing right now is not going to work. We need to be able to disrupt the status quo. At the end of the day, government cannot do it alone. Government has the responsibility of providing access to healthcare to every Nigerian. But how many healthcare centers are working? So the truth is that public and private sectors have to come together through close cooperative and strategic partnership. Also, intersectoral rivalry needs to be put to rest. Pharmacists and doctors must be united because we have a common goal, which is Nigerian patients. It cannot be business as usual. We need to understand the challenges affecting us and build strategic collaborations. She added that an investment of about $15 billion is required to close the infrastructural gap existing between the pharmaceutical industry in the country and those of countries like India. She said,
"We must keep an eye on the future. The role of 3D printing, the role of virtual models in testing, the role of blockchain technology, artificial intelligence. And we as pharmacists need to know all of those technologies, maybe not more than 3 questions deep, but we need to be able to close that divide. We need to innovate, trainnovate, educate. We need to disrupt and change our mindsets. We need to stop talking and start acting."
She also lamented that only 3.8% of the consolidated revenue budget of the country goes to the healthcare sector, as against the 15% agreed upon at the Abuja Declaration.